Hi, this is Doug,
This is Margie.
and we're a fit couple in the Philippines talking today about healthcare insurance coverage in Philippines. She's going to continue to cook as she just started, and I begged her to come over here and just get in the intro at least. I want to talk about healthcare coverage in the Philippines because this is a question I get asked a lot. A lot of expats that know me here know that I've been an RN for most of my life, and I used to work for insurance companies as a case manager and really dealing specifically with this topic, what's covered when a patient goes overseas. I actually had patients that I case managed that were overseas at the time. So let me tell you how it works. Commercial plans do cover you in case of an emergency pretty much anywhere in the world with a few caveats. It has to be a true emergency, and a lot of times you have to prepay that place that you had your service at, and that's going to be the case here. If you have an emergency and you get into a hospital here, there are many hospitals, but if you get in lucky to get into one of the JCI approved, there's actually only four JCI approved hospitals, and that's St. Luke's Asian Hospital and Makati Med. And then there's one, and that's those three are in Manila and Makati, and then there's one in Cebu called Chong. So if you are lucky enough to get into one of those hospitals, then you sometimes, probably most likely, are going to have to pay the bill before you leave that hospital. And international, your commercial plan does cover you internationally in case of emergency. Now, the other thing to do is look at buying an international health coverage plan. And you can Google it, and they are out there. Just make sure you read the fine print, because check the percentage of coverage that you actually get, what your deductibles are, what it entails. And one important thing I would really look at, and this is me being a case manager, is find out if you got in an accident and ended up in this very small hospital at this beach town next to your resort out in the middle of nowhere, will they transfer you back to Manila to one of those JCI approved hospitals, or to Cebu if you're closer there, to get the treatment that you need? Or will you, because transferring to the right hospital could be a life or death type of situation, and you don't want to stay in one of these little hospitals if you're going to be really sick. That was just the umbrella falling. And that's what I did as a case manager. I transferred people out to a more comprehensive hospital. And believe me, these hospitals, I've been in Asian Med and I've been in Makati Med, or Asian Hospital and Makati Med, and they are very, very nice hospitals. They're just as nice as our hospitals in the U.S. They pass the same stringent standards, and in a lot of cases, the doctors were educated in the U.S. or in England or somewhere, and same with the nurses, and they have very highly trained staff that will take good care of you. And you probably heard that, the Philippines has a very high education level, and they do have a lot of doctors and nurses here. So you're in good hands when it comes to being in a place with lots of doctors and nurses. But you're not in good hands if you are trying to come in over here and trying to use your Medicare. Medicare does not cover you outside of the U.S., just point blank. There's rumors that Medicare, they're working on trying to get Medicare coverage for people that have dual citizenships or people that want to move out here, and they have like a Medicare Advantage plan, but nothing's been passed yet. The Medicare will only cover your care inside the U.S. Now, back to paying first. Most, and that's the good news too. The doctors here are very inexpensive. You can go get an MD consultation. Let's say you've had a pain in your knee and it just won't go away, and you've tried taking over-the-counter medications and you just want to see a doc about it. You could go see an office consultation. You could go straight to see an orthopedic doctor and get an office consultation and pay 300 pesos. That's about $6. You could probably get your x-rays for another 300 pesos, along with your lab test for another 300 pesos. So you're walking out of there with spending less than $15. My co-payment was like $15 in the US. So it's really, really inexpensive. And also, if you get admitted to the hospital and let's say you do have to have some surgery or you caught some infection and you have to have IV antibiotics, your hospital stay is only going to cost you about $50 a day. But like I said, you are going to have to clear your bill and pay your bill before you leave the hospital. And if you still have insurance in the U.S., you could pay it and then try to get reimbursed from your insurance in the U.S. Otherwise, you're just going to have to pay it, and hopefully you have the money to pay it, because I actually know of an expat that didn't have the money to pay it at the time, and they kept him there for an extra week while he found somebody that was going to come into the hospital and pay his bill for him, and so he could be discharged. And in the meantime, his bill is just increasing daily. But luckily at a lower rate than what you would pay in the U.S. Just to give you a little idea of where I'm coming from, and you could look at my background on my YouTube channel and also look at my website, Pasadena Hardcore Fitness, and you can see a bio that I've been an RN and a case manager for over 20 years, and I've dealt with this type of situation for many patients for many years, and helped them make it through it, and helped them, put them in the right hospitals, put them in the right direction. It's not easy to understand, and usually most people don't understand their insurance policies. So do yourself a favor before you come out here, or when you're out here and you don't have insurance, research it, look up that international coverage plan and find out what it covers. Know that your Medicare is not going to work here, and also know that your commercial plan that you are continuing to keep from your employer, or you've been able to continue because of some type of pension plan, then you need to know that it's only going to pay for emergency admissions and emergency type of situations for the most part. You could always email me or message me or just make a comment on my blog, and I'll be happy to get back to you. If I don't have the answer, I will ask around. And I've one of the things, the rumor that goes around, that you could get Phil Health while you get here. Well, when you get here, Phil Health is the coverage plan for Filipino citizens, and in some cases it could be for an American that has an A13 visa, or a foreigner that has an A13 visa. But don't come over here thinking you're just going to walk into an office and get Phil Health insurance. It's not that easy. Your best bet, like I said, is to research the internet and get some type of international coverage policy, and then research that policy and making sure it's the right one. Anyway, that's it for now. I just wanted to cover that topic real quickly for you. And everybody has their own story, and everybody has their individual case. So feel free to message me with that, and I'll get back to you. Thanks.